guys need a sound check? Jill Udford, Chief Executive of the Murrumbidgee Local Health District. Okay, well, good morning, everybody. Here today to talk about where we're moving in terms of managing COVID right across the Murrumbidgee Local Health District this week. And in fact, moving forward now, we're coming up towards Christmas. So some really good news to start today. Today is the first day where we've had 0 cases recorded in the Albury LGA, which is fantastic news for that community. And I do want to reach out and thank that community who have done an extraordinary number of testing and isolation periods, and a good percentage of that population who have tested positive for COVID during the outbreak over the last month, and our schools who have worked with us diligently during that time to bring the outbreak under control. The other really good news is that we've been working very closely with our Victorian counterparts and treating that outbreak as one across 2 different state jurisdictions. And we've been working under emergency management protocols with New South Wales Police and all of the other agencies involved in emergency management, and coming together every day to help manage that outbreak. The other good news is that as of midnight tonight, the outbreaks in the aged care facilities have now passed their period, and there haven't been any new outbreaks there for more than 14 days. So that's really great news in terms of keeping our elderly people safe. But I do want to again acknowledge that during this time we have seen 10 deaths in aged care facilities during this outbreak, and again, extending my heartfelt condolences to families, to friends, and to the community for such a tragic loss. Other thing that's happening today is a change in how we're reporting venues. So as we are now a populated community and we're out and about with the lifting of travel restrictions, we need to also have a look at some of the settings that we had put in place when we were working under lockdown regimes. So now we are not reporting any more venues of concern. That happened in Sydney and the Greater Sydney area quite a number of weeks ago. But I just want to reassure people that if there is a venue of concern, that we will absolutely make that evident. And we gave some examples in the past about a gymnasium in the CBD in Sydney that was a concern. We had one here in our region recently in terms of a church. So we'll continue to do that. It doesn't mean we're no longer contact tracing. Yes, we are. We're just doing that directly with the people involved, and we will contact close contacts directly. They'll all receive a text. So people who need to know will know in a timely way. The reason why we are no longer publicising them is because we are now a vaccinated population, and we know that there is limited transmission in places like supermarkets and those sort of places where we have a lot of people all wearing masks, all following the social distancing requirements, and it adds that layer of protection. So that's just part of now how we're working and living around managing COVID. In terms of hospitalisation, we still have 126 people who we're caring for in our region with COVID-19. And what we're seeing is people and patients who are much less sick than they were when we started looking after COVID about 20 months ago. So only 2 of those 126 are in the COVID ward. We have got 1 patient in the intensive care unit, and the remaining people are being cared for in care in the community while they're isolating at home. And once again, we see the clinical care of people who are at home with not a lot of heavy symptoms. 30% of their care is clinical, but they do have a lot of other care, social care requirements that we need to look after them in terms of their mental well-being, some of their other disease factors, medications, how they're going to stay at home and get food and supplies. So we work very closely with people in that way. The other thing that we've seen is introduction of rapid antigen testing, and the example of how we've used that in our region is the trial that we have been doing with the schools in Albury. Fantastic uptake from all of the schools, and actually the timing was probably perfect if you can make something good out of an outbreak. And that was because the higher school certificate was starting around that same time period. And again, our colleagues in education have reported to us that they have seen a much higher level of confidence from the school community in terms of people wanting to come to school and feeling that the environment there was made safe. And also feedback from teachers that it gave them that level of assurance too, that children could have that continuous learning process. So here in Wagga Wagga though, we are seeing cases rising. The numbers are not high, but we do have some transmission in the community. So if people abide by all of the COVID safety rules, in terms of wearing masks if they can't socially distance outside, wearing masks inside, and what is really important, please, if we could continue to ask people to make sure you scan in using your QR code. So if there is a case that has been notified, that we can then get the data and do that contact tracing and surveillance through all of the data that we can download. So that's, I guess, how we're going with Wagga. There have been a few schools impacted, and again, I just want to thank the schools for working with us. I think we're getting better at schools doing a timely assessment of students who might be impacted, and instead of a whole school going out and non-operational, just one particular class or one particular bus load of students being isolated while that cleaning is undertaken. Testing also remains really good across the region, and 14,270 tests were undertaken in the last 7 days all across our region. And certainly the timing of opening up the new drive-through at the showgrounds that Murrumbidgee Local Health District is running in combination with the private providers who continue and have done a fantastic job during this whole pandemic. So just in our 2 testing clinics over the weekend, we did 824 tests. And we'll continue to provide testing. As we move in towards Christmas, there's something really important people need to continue to do. The first thing is, do you need your booster jab ready for Christmas so that you can go to your parties and that you can meet up with your friends and feel safe? So the Christmas booster jab needs to be on everybody's agenda. That is the 3rd dose that all people over the age of 18 can come forward and ask for once they've completed 6 months interval between their 2nd Pfizer vaccination or AZ vaccination. So consider your booster dose for Christmas. And we're out and about too this week, continuing on with our vaccination. Our vaccination rates are so good now in our region. Over 97% of people in our region have had at least 1 dose, and we have hit for the first time over 90%. So 90.5% of people in the Murrumbidgee are fully vaccinated, which is a fantastic result. We've still got a way to go though with our children aged 12 to 15 years. There's more work we need to do there. We're still only 62% fully vaccinated, so that rate needs to definitely come up. So if you haven't already brought your children forward for vaccination, here is your chance. Corowa Hospital has been an area of concern over the last week where we've seen an outbreak in that facility. I am pleased to report today that there are no new cases associated with the Corowa Hospital. And so far there have been 5 staff infected and 4 patients. We have introduced rapid antigen testing for all people entering the hospital to make sure that we do that surveillance testing at the commencement of every shift. And the staff are continuing to work there, and just want to repeat, the hospital is open. It is really important that people present to the hospital if they need, particularly emergency care. Please come forward to the emergency department. We have our COVID safety protocols in place, and we're certainly well placed in managing COVID-19 outbreaks should we get one in any of our hospitals. So I'll leave it there, and I don't have a police colleague today because we have a new superintendent starting this week, and I'm looking forward to meeting him as he starts. So I'll go straight to questions.
Jill, in Wagga, there have been a number of educational facilities linked to cases. Are you able to confirm any of those? I've got the Kapooka Early Learning Centre and Holy Trinity Primary School among them. Can you confirm that they've been linked to cases last week?
So I probably don't want to list places by name. I think what is important is that schools and early learning centres contact parents directly if they are a close contact, and that's really all we need to be focusing on. So I won't go through, it's a bit like not listing all the venues. We'll certainly let you know if there is a school or a venue of concern. But otherwise, again, it's all about the protection of people who are the case. We need to protect their identity, and if we have a small, for example, early learning centre, we don't want to possibly risk the privacy of that particular person. So we will keep those venues to ourselves, but let you know if there's any public health risk.
Absolutely. Just on that, with the educational facilities, are you concerned about, I guess, the lower vaccination rates among under 16s, and then also going into under 12s? Where are we at when looking at vaccination for that age group, and is the lack of vaccination perhaps one of the reasons that we are seeing these outbreaks?
Yeah, most certainly. And of course, for under 12s, we have a wholly unvaccinated population group. And little children tend to run and mix and act in a very different way, and you can't really expect them to abide by COVID safety rules the way adults do. So that, again, and they can become spreaders within the community. Fortunately, children don't get so sick when they catch COVID, but they're good at spreading it. So we really look forward to the TGA, the Therapeutic Goods Authority, will be reviewing the vaccine, and at this point in time Pfizer is the only company that has put forward a vaccine. There's trials being undertaken in the US, and as soon as that information is available, then the TGA will review it, and obviously we're all hoping that we'll receive that news next year and we can then start vaccinating our children. The 12 plus, so the 12 to 15 year olds, is where we really need to be focusing our efforts and vaccinating and getting those vaccination rates up as high as our adult rates. And I do expect that will grow quickly now over the coming weeks, as a lot of, that was the last cohort of people to come forward for vaccination. So if we can get that level high, interestingly enough, research shows that they do in some degree protect the younger children in a family setting as well. So adults, the teens vaccinated, will then offer that layer of protection to some of the younger children.
Absolutely. Just finally, is there any thought to doing their rapid antigen testing at Wagga schools? Is that something that has been undertaken or will be undertaken, given that, again, they are linked to so many of the cases? They do seem to be quite sort of education focused.
Yeah, and look, the trial that we're undertaking in Albury is still underway, and certainly whilst we've had really good feedback, I think we just need to pause and have a look at the results from that trial. And certainly the Public Health Unit in Sydney will be doing that, and then looking at what we need to tweak in terms of consideration for usage for other school outbreaks.
Are there concerns around the outbreak across the Federation Shire, and what's your advice for residents of that area?
So in the Federation Shire, or LGA, we're seeing an outbreak, I guess, on two sides of the river, where we have had some community transmission, and people who live in that community, the river is not a barrier. People move backwards and forwards across those communities naturally. So yes, it is a concern, but I would say to people, it's just important, if you have even the slightest of symptoms, to come forward and get testing, because the way that we manage an outbreak still to this day is to diagnose COVID early and get people into isolation, so that then reduces the transmission. What we're seeing is more people being asymptomatic now we're vaccinated, but people will still get some symptoms, so let's get those tests done. And the isolation period also is changing, and so good news again for people who are fully vaccinated now. They can come out of isolation sooner than they could before, so that's also good news in terms of us living with COVID going forward.
What's that sooner timeline?
So we'll get some information to you about those changes. They're available on the New South Wales website, so we'll get Sam to send those through. Yep.
Just the Corolla cases.
Corolla, yes.
Corolla.
Not to be confused with Cara. Corolla, yes.
Are you able to tell me whether they're linked and if they were active in the community?
So once again, we're moving away from looking at every single case and trying to trace where they've been and what they've been doing. But when you get an outbreak the size of the one that we saw in Albury, there's definitely seeding that occurs because people naturally go shopping in the larger centres and mix with friends and do other things as well. So I guess the news is, and today, and what we've seen over recent days is that a lot of the new cases are actually household contacts or linked with a known case. So our contact tracers are doing great work and making sure that we're seeing that. And in Wagga, for example, all of the cases today are actually known contacts or household contacts of an existing case, which gives us the reassurance that the community spread is lessening.
And are you confident that the Albury outbreak is under control at this point, or is there still concern?
Look, we will continue to see cases come and go there. Just because we've had one day at zero doesn't mean to say it's gone. It's still there. It's COVID is all around us now. As people move in and out of our communities, it is always a risk. And certainly we'll continue to see some case numbers there, but what we are all hoping is that those case numbers will be low and that there'll be less community transmission.
So case around Wagga and Federation, are they also linked to each other as well, or are we finding that they're popping up sporadically?
Yes, yeah. What we're finding now is the majority of cases, and all of the cases today in Wagga, are actually epi-linked or household contacts of a known case.
And same with Federation?
Yeah, most of them, yeah. What happens though is when I say most, some cases, because the cut-off time's 8 p.m, so if we get a case in late in the evening, we just haven't had time to do the interview yet to actually ascertain whether or not it's linked. Yeah.
Jill, just a quick question for Aubrey. How are schools going? You did sort of touch on this, but I guess if you have any comment on how schools are going with the rapid antigen testing trial so far, and also if health authorities are confident that it's helping to control and reduce the outbreak in schools, which...
Yeah, well, rapid antigen testing in this case is being used as a surveillance testing where children at home do the test twice a week, and again making sure that only children who have got that negative test are going to school, which gives people a level of assurance. So for that to be effective, we need good uptake of the tests, and certainly the school and principals have reported there has been good uptake, so that's a big tick, and everybody wanting to do the right thing. And we also haven't had any positive rat tests coming forward for swabbing as well, so that is a really good indicator that it's been successful. But it is only for a short period of time. It's really for that 2-week period to break that transmission and make sure that the children going to school are not in the early time frame of having COVID and then being in that infectious period. So it certainly has been successful in that respect. But we'll continue to see outbreaks in schools, as we said before, an unvaccinated population.
Given outbreaks in hospitals and elective surgeries are set to restart soon, now, whenever, how is that playing with each together? Like, how is elective surgeries returning going to work with staff perhaps being in these hotspots?
Yeah, so let's start off with elective surgery. In our region, we did not ever pause elective surgery, so appreciate that in Sydney, where we had very, very high numbers of people who were hospitalised in intensive care units, they did pause surgery, and that was mainly to redeploy the workforce who were working in the operating theatres into helping to care for COVID patients. So at that time, we didn't have high numbers of COVID patients, so we have not paused our elective surgery. We have continued on, so that's been good. But we are COVID testing patients who come in for elective surgery just to offer that level of protection to all the patients in the hospital as well.
And to sort of reiterate and clarify, the change with not listing case locations, it's been going out that there's venues of concerns and notifications have still been going out. But what is the difference with the change? That it's not it's not like case locations. Just clarify. What is the difference? Because it seems like it's almost the same thing, or it's just like business as usual.
I think everybody's confused about the venues because there's two ways of checking venues. The first one is through the Service New South Wales app. So if a COVID case has been to a venue where you have been, you will receive that notification on your phone through your Service New South Wales app. But that doesn't mean anything apart from the fact that you should just keep an eye on yourself and monitor for symptoms. You do not need to be tested, and people will get those notifications from time to time. So I think when those started, people were very confused around the other thing, which is the New South Wales venues of concern, where we actually said to people, if you read this and you've been to that venue at that time, go and get a test. So now we're saying, actually, living with COVID, we're going to go in and out of venues from time to time where there may have been COVID people. So we'll contact you if you need a test. So that's the difference. Don't do anything unless we contact you, and we'll tell you if you need a test.
Fantastic.
You don't have to go and check the website through all those thousands and thousands of listings anymore. Those days are gone.
So it's simplified the process.
Simplified the process. And also I think the other thing that we saw is when people started getting those Service New South Wales notifications, they started spreading it across their friends, and the message got a little bit lost that, you know, people needed to go for a test because they'd been to a particular business. We need to not do that anymore because it's not great for the business. And businesses are doing an absolutely sterling job in terms of monitoring COVID. New South Wales Health will contact them, and we will do the contact tracing of any people who have been in their business. And the businesses look after staff. So if they have a COVID positive staff, they work with Safe Work New South Wales in terms of managing their staff.
So anyone who needs to get a test will be contacted directly?
That's right, by New South Wales Health, yes.
And sorry, just one last question again from Aubrey. It says lowest numbers we've seen on the border since this outbreak began, but is there an anomaly causing this? Is there any chance testing numbers are low, or has there been any delays in getting results?
So yeah, we're always sceptical when we hear good news, but it's a good question because it's all our detection of COVID is all predicated on people coming forward and having a test and not ignoring symptoms and then having community transmission occur without us knowing it in a community. But I do want to say that the testing numbers have maintained at a high level and a good level in Albury. They are not maintained at that very, very super high level that we saw, but that was an anomaly really caused by whole school communities coming for testing and all at once. And lesser people will come out on weekends and on days like Melbourne Cup Day. However, the percentage has remained good in terms of testing. So I just say to people, we're not out of it yet. We can still expect cases, but the most critical thing you can do is to come forward and get tested even with the mildest of symptoms. Thank you. All good.
Thank you.
Thank you.